Hey guys, it's Dr. Eric Shoemake with Axiom Health Solutions, and I want to discuss something today that 90% of you will deal with in your life, and over half of the people in this country live with on a daily or weekly basis, and that is chronic back pain or sciatica. Now, you've heard of the sciatic nerve before. People talk about my sciatica, and I'm going to give you some real solutions, what I call in-here solutions, versus the wrong way to deal with it, which is what most people do out there, which is going to like a traditional doctor. So let me get into the cause and then the solutions, real solutions for back pain and sciatica. So I'm going to take you through what this actually means. If you're suffering with this, pay attention. If you know somebody who's suffering with this, pay attention. So the first thing I want to discuss here is the real cause of the pain. So when you have pain in the back, especially the sciatic nerve, there's three nerves in your back, specifically that form the sciatic nerve that start down here. Okay, so they'll start in this area here, and that nerve can be compressed between two bones. And when it does that, like you'll see this nerve right here, that's called a subluxation. That's where any bone or vertebra is out of alignment or stuck out of position. Now, why would that happen, or why could that happen? That happens because most of us sit on a computer all day. There's a new article that came out a few years ago called "Sitting is the New Smoking." Like, sitting is as bad for your health as smoking a pack of cigarettes a day. There's car accidents, injuries, sports injuries. But over time, you can lose the normal alignment in the spine. It will pinch this nerve. Now, the thing I want you to understand, when most people get diagnosed with sciatica or low back pain, the first thing they're going to get is opioids. Now, opioids are prescribed in over half of back pain cases, and it's the leading class of prescriptions for back pain. Now, think about this for a second. This is a physical problem right here. There's a physical compression of that nerve, and they're treating it with chemicals. Over 100,000 people a year die from opioid overdose in this country, and over half of those people got put on those drugs for back pain, which is completely senseless because you're trying to fix a physical problem with a chemical that doesn't do anything about the actual physical problem, but just blocks the pain nerve to your head. So it's created the biggest drug epidemic ever in history right now is because of opioids. Right. So, and then if you don't want to do opioids, then there's back surgery, and I'll discuss that as well. But the simple thing that you got to look for here is there a misalignment that's compressing that nerve? And if it's compressing L3, L4, or L5, that's the root of the sciatic nerve that goes down into your leg. That's why so many people have pain in their back, pain shooting down to their leg. They may even have something called spinal stenosis, but that's all under the same umbrella of sciatica. Now, here's what we do. So the solution out there is opioids and back surgery, or just living with it and being miserable. The solution is finding the cause of the problem. And what we do to look for the cause of the problem is we do a full examination, range of motion test, and then usually x-rays and a flexion extension or a motion x-ray. Now, here's what I want to show you what's happening on an x-ray from the side. So what you're designed to have in your low back is you should have this 45-degree curvature in the low back. So you should have a curve that goes all the way through here like this. What this person has is no curve. So it's almost completely straight through there instead of having this nice curve. So because of that, all the weight gets put onto the front of the bones right here, and it starts causing these discs to bulge backwards. Okay, so these bones are misaligned. Now, the way that we know that is you can measure the angle of the disc here, right? So you do take the end plate of this bone and the end plate of this bone, and this space right here is called the disc. That's a disc. That's a disc. And if you look at these numbers back here, we're looking at 3.8, 6.5. Those numbers should be at least 12. There should be at least a 12-degree angle there because of the normal curve. This person has 4.6, 5.6, 3.1. And this person has sciatica and low back pain because these nerves are being pinched right here, because these discs that should be functioning normally and have this normal angulation right here, these discs are actually compressing back onto these nerves, and that's what's causing the pain shooting down to the leg. Again, how much OxyContin would it take to fix that? How much Advil would it take to fix that? It's never going to fix that problem. So what we look for is the angulation over here. So when you see the angle of the disc here, 12.7, 15, 16, 12, right? So all of those through here are normal. So that what that means is the disc is set up normally to where it's not bulging back into these nerve roots right here. So the solution is very simple. If I see somebody that walks in that has this problem, we provide specific chiropractic adjustments to start correcting that, to start repairing that curve, which you can now see in here. You see the curve, which you should see over here, but you don't. You see it's completely straight. And you can actually repair that curve through corrective chiropractic care. Now, most chiropractors don't fix a curve in your back. Most of them don't even take x-rays, unfortunately. We do what's called corrective care. So we'll take the right x-rays, we do the right rehab exercises, because if you just get adjusted, we're not going to put that curve in your back in one visit. So it requires a certain amount of visits to correct it, but then also you doing rehab exercises at home to buckle the curve back in there and actually build the ligaments and the soft tissue that will hold the adjustment for a lifetime. It's not just patching it up, it's fixing it for a lifetime. So this patient came in to see us with severe back pain going down into her leg. So severe pain into her leg. She was having digestive problems. These same nerves right here go to the digestive system, by the way. And they were looking at doing back surgery. And she didn't want to do back surgery. So we took an x-ray, found that this was her problem, started doing the corrective adjustments and corrective rehab. This is her x-ray 90 days later. And what do you see 90 days later? You see a curve. You see the normal angle of the disc. You don't have any compression on these nerves right here. Guess what happened to the sciatica? Gone. Guess what happened to the back pain? Completely gone. She can garden again. She can go on a hike again. She can go on a cruise that she wanted to go on. And the other solution was going to be back surgery. That's what they were looking at. And people are like, well, mine's not bad enough for back surgery. But what you have to understand, if that doesn't get corrected, you're going to get enough degeneration where they don't have a choice but to do back surgery. And there's actually something called failed back surgery syndrome, which is where you go in and have these 3 rods, or actually 8 rods or 8 screws and 2 rods in the back. That surgery fails 60% of the time. It doesn't even correct it 60% of the time. So there's something called failed back surgery syndrome. It's so common. So instead of going that route, it's simple. We get to the cause of the problem with a set of x-rays, flexion extension x-rays for most people, and then we find out, can we correct this, and can we do it naturally, and can we get to the cause of the problem? So again, if you're dealing with back pain, if you've ever dealt with sciatica, or you know anybody with degenerative disc disease or anything like that, here's the solution. It's not opioids. It's not, a massage that helps just the muscles sometimes. It's getting to the cause of the problem, unpinching those nerves, and allowing your body to do what it was designed to do. That is our job, and that's real health solutions.